Hello, dear ANA community. What is the significance of Upashaya? That is the topic of discussion in today's video. Dear ANA community, put a thumbs up and spread this particular video so that we can have the huge movement out of this particular small message. And don't forget to put the bell icon so that the YouTube algorithms will help you to have the right video at the right time for the right purpose. The term Upashaya, that is considered to be one of the Nidana Panchaka, wherein the person is going to have the improvement in the presenting complaints. So this particular improvement may happen because of the different trial and errors as such. For that, you have to see the video on the concept of Upashaya. Here we are going to know about the significance of Upashaya as such. The textbook says, Asati Upashaya Abhidhane Sankirna Lakshane Anabhivyakta Lakshane Va Vyadhau Visheshabodho Nasya Taduktam Charake Gudalingam Vyadhim Upashaya Anupashayabhyam Pariksheta. This is the significance of Upashaya. So, wherein Gudalinga, in the sense the diseases which are very difficult to identify or predict, so that will be diagnosed by the help of Upashaya. It may be because of the consumption of the different food substances, or it may be because of the medications as such, or it may be because of the different vihara in terms of the regimen as such. So that is considered to be Upashaya and Anupashaya. If the person is having the improvement in the presenting complaint, that is considered to be Upashaya. If the person is not getting any improvement, that is considered to be Anupashaya. So let us look into the timeline, why we need to know about the Upashaya as such, so that we are going to learn today. Whenever if you think about the example here, so here it is an example of the 5-day clinical presentation. On the first day, he is having the Shita Vata exposure, cold air exposure. Whenever he is having the cold air exposure, so the most common areas where the person will be having the cold air exposure will be the skin, nose, mouth, eyes, etc. Whenever if there is the exposure into the skin, the person will be having the peripheral vasoconstriction, wherein the person will be feeling the coldness of the body parts. Wherein the person who is having the exposure into the cold air into the mouth, the person will be having the dryness of the mouth that may take place. Whereas the exposure of the cold air into the nasal cavity, so that may be responsible for the dryness of the nasal mucosa. Wherein a cold air exposure into the eyes, so that will be responsible for the itching around the eyes or reduced secretion that may take place in the eyes region. So whenever if you look into that, day 1 he is having the exposure of Shita Vata. Second day he is having the presentation of a Kasa, and he is having the little bit amount of the sputum production. In that particular sense, whenever if you think about the connection with the day 1 day 1 event, so we may say that the person is having the exposure of what is cold air exposure is more in the respiratory system, or what we can say the pranavaha srotas. And third day he is having the Dadhi Sevana plus he is having Shitavata exposure. In that particular situation, he may be having the fourth day he is having the Kasa and Bahu Nishtiva. So he is having the again the presentation of a cough, but this time he is having the more amount of sputum production is there. So plus he is having the Tvak Sankocha. So that means he is having the what do you say, that the chill or coldness in the skin as such. So here we may say that there is a possibility of the exposure of the Shita Guna into the Pranavaha Srotas in plus into the Tvak as such. Tvak, so that is being identified by Tvak Sankocha and Pranavaha Srotas in the sense, so here both respiratory system and alimentary canal, the two upper alimentary canal affliction we may suspect in this particular occasion. So on the fifth day, he is having the jwara at the morning. So usually whenever the person is having the presenting complaint, so if it is not controllable by him or her, then they are going to visit the doctor as such. So at that particular time, suppose if the person is going to consume the Ushna Jala or Ushna Virya Dravya, that means in terms of the medication as such, so that may be considered to be improving the presenting complaint. So that is considered to be Upashaya. If the person is going to consume Shita Virya substances itself, then that can be considered as Anupashaya. In other words, whatever may be the Nidana Sevana done by the patient, that can be considered as Anupashaya. And the measures which are considered to be responsible for the submission of the symptoms as such as here Ushna Jala and Ushna Virya, etc., that can be considered as Upashaya. So let us have the what is the significance as per the text that is being mentioned is Charaka Vimana 4th chapter 8th shloka. While discussing about the Anumana Pramana, he has given this particular description. The same is being mentioned in Chakrapani commentary in Charaka Nidana 1st chapter. That is Gudhalingam Yadhim Upashaya Anupashayabhyam Pariksheta. So that means whenever if you are looking into the discomfort as such, where we are not in a position to identify the pradhana srotas that is being afflicted, then we are going to utilize Upashaya and Anupashaya method. So that is what we can say, trial and error method. So this particular example, the person is having the pain in the knee joint. In the sense, there will be the possibility of a Astivaha Srota affliction or Majjavaha Srota affliction, or Astivaha and Majjavaha Srota affliction we may suspect here. So in this particular occasion, so if you are using the oil and you are applying the oil to the knee joint, and if the person is having the worsening of the symptom, so that is indicative of the Snigdha Guna, so that is responsible for the disease manifestation. Snigdha, Guru Guna, etc., that may be considered to be responsible for the disease manifestation. That means he may be suffering from Amavata. And if you are applying the oil to the knee joint, and if he is having the improvement in the presenting complaint, so that is the improvement in the severity of the presenting complaint, then it may be considered to be due to the presence of the Laghu, Ruksha Guna, etc. So in that way, so the person may be suffering from Sandhigata Vata. So that is not the Amavata. In other words, Ama is not present at that particular time period when the person is having the improvement in the presenting complaint after application of the Snehan. If the person is having a worsening of the presenting complaint after application of the oil to the knee joint, then that may be considered to be Amavata. To sum up, trial and error, what we can say the Upashaya, that helps to confer or reject the diagnosis. If the measure may be in the terms of the Ahara, or in terms of the Vihara, or in terms of the Aushadha, if it is improving the patient's presenting complaint, then it is considered to be Upashaya. If it is not favoring the patient, then it is considered to be Anupashaya. So, clinical significance is Gudalingam Vyadhim Upashaya Anupashayabhyam Pariksheta. Dear AMA community, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Wait, don't forget to give the thumbs up and put the bell icon so that YouTube algorithms will fetch you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.